The only other thing is just something that we don't take care of, but would be a vasectomy. We don't necessarily have any experience with that personally, but that's another option for women, is for them to actually not have that that need on their own, but for their partner to take care of that. And then for people who want absolutely no hormones, they don't want to have anything invasive, whether it's a Paragard or anything, we also have some other options that Dr. Vaughn is going to talk about.
Well, there is a form of birth control that is 100% effective, and that would be abstinence. So by not having intercourse, you can't become pregnant. Therefore, it is a form of birth control. There are the methods, the fertility awareness methods, where you basically count your cycle and know the days you're most fertile and avoid intercourse during those days. It is perfect with perfect use. The failure rate's about 10%. With typical use, it can be as high as 40%. So if you're okay with having that high risk of failure and you're very good at keeping up with your cycles, that might be a really good option for you if you don't want to use any hormones or any other forms of birth control. Condoms as well can be used and have a typically about a 5% failure rate. Again, can be somewhat cumbersome and has to be planned a little bit because you have to have them available. And then something that we don't use a lot of, but I have had some experience with, is using diaphragms. And a diaphragm is a small cup-like device that you do place at least 30 minutes prior to intercourse with spermicide. And it is effective, again, does have a failure rate of about 5 to 10% with typical use. And you must leave it in for 6 to 8 hours after having intercourse. It does require a doctor's visit as well, because you have to be fitted with the device, because everyone is different, is a little bit different shape and size, so you want to make sure you have a size that's comfortable for the patient, but is also large enough to cover the cervix to prevent pregnancy. So that's another option. Again, though, it requires a little bit of planning and decreases spontaneity a little bit. So those are other options as well for patients who want birth control but don't want to use a device or hormones or pills.
To find out more about the best birth control option for you, call Virginia Physicians for Women and make your appointment today. Experience the VPFW difference.